Good morning all. I would like to speak about EYESPIRATOR, which is an innovation for ORBT and Oculoplasty surgery. In surgical practice, it is essential to provide a clear and bloodless working field. Hence, a section apparatus are required. Is an important part of surgery. Ophthalmology as a surgical branch involves small quantity of blood loss. Like in cataract surgery, it will be less than 5 ml, and orbital surgery around 75 ml. However, small area of surgery and delicate tissue is a unique challenge in aspiration of blood. Also, there is pooling of blood and fluid in deep socket, and the bleeding is an important. It's an challenge in surgery, especially in orbital surgery, which require deep tissue access. Over years, there are many types of aspiration equipments like angiosterometer, manually operated suction pump, electrical suction pump. But the pressure in these instruments are very high, and also the suction tips are very large, which is difficult to maneuver in the small orbital field. Aspirator, our innovation, is made to solve the problems created by aspiration equipments. It is an easy, do-it-yourself and cost-effective and efficient tool to aspirate small amount of blood in surgical field. It can be made using recyclable and easily available components. It consists of a foot pedal, a DC adapter, a DC water pump, an intravenous set, and collection bottle and a bottle stand. And it works by direct current, which is connected by a adapter, and this adapter is connected to a foot pedal, which acts as a on and off switch. And this foot pedal is connected to a self-priming motor, and to the aspiration end it is connected to a tube which is connected to an opening in the collection bottle, and which will create a vacuum inside the collection bottle. And there is another opening on the bottle which is connected to the IV set, and this IV set is connected to the, it can be the other end of the IV set can be used in the surgical field for aspiration. So when the foot pedal is on, it will on the motor, which will create vacuum inside the tube, inside the collection bottle, which will aspirate the fluid inside. There's a video, I will play the video in the last. So the advantages are this aspiration is controlled effectively by foot pedal as and when required, unless the conventional aspiration tube, which is always in on. And the opening of the drip set is small and flexible, which can be easily maneuvered in small surgical field. And new IV set can be used for each surgery, which will avoid the need for sterilization of the whole equipments for each patients, and it will avoid cross infection. And the entire apparatus can be sterilized by ethylene dioxide sterilization, and it is cost effective because the entire equipment will cost less than 1,500 rupees, and can be used for orbital surgeries like dactyocystorhinostomy, dactyocystectomy, excision biopsy, orbitotomies, and eviscerations. These are my references. I'll play the video of working of the instrument. Oh, so this is the adapter which is connected to the power source, and which is connected to a foot pedal, and this is the motor which is connected to the collection tube, and this collection tube is a used saline bottle. And from here the IV set is connected, which is going to the surgical space. And we saw that it is clearly aspirating all the blood and giving a clear surgical field, which makes the surgery more easy and reduce the time of surgery. The blood is aspirated when the foot pedal is on.